first, we do want to break down this stay-at-home extension that the governor just signed. It's more than just an extension. It's also making some changes. Political reporter Rick Alvin will go through it for us right now. Rick?
Yeah, this is an extension, as you say, and accurately, it cracks down even a little bit more on some areas. We're going to get to that in just a second. But first of all, I should tell you that yesterday, when we first broke this news, we knew the governor was going to extend it. We didn't know how long. Now we do. It's till the end of the month. And we also didn't know if she would loosen some restrictions, which clearly she did not, and explained why she would not. But here's what she added to it. Starting tonight at midnight, those big stores that have great square footage will only be able to have 4 customers per 1,000 square feet. And for the smaller stores, it'll be 25% of their overall occupancy limit. So that's going to create some interesting circumstances. Could make lines outside waiting to get in these stores. And if that happens, the stores have to provide markings for the 6-foot interval so people will stay away from each other. And with cooler temperatures coming up, that may be an interesting circumstance, but those are 2 of the new rules that she put in place. And also for those big box stores, you know, we heard some people complaining that if landscapers couldn't be open, well, then why can landscaping and garden things be sold at those big box stores? Well, starting at midnight tonight, they can't. That includes garden centers and plant nurseries. You can't buy paint, you can't buy furniture, you can't buy flooring at those big stores. The governor talked a little bit about that order earlier this afternoon.
Dr. Fauci, who we've all come to see on our television with great regularity, said we need to keep pushing mitigation strategies because there is no doubt that they're having a positive impact on the dynamics of this outbreak. Now is not the time to pull back at all. It is the time to intensify. That's exactly what we're doing. If you're not buying food or medicine or other essential items, you should not be going to the store. Your grocery stores will remain open. Your pharmacy will remain open so you can get your prescriptions filled. Your banks and credit unions will be functioning. You can still fill your car with gas.
So the governor has extended the stay-at-home order. She said she was not going to allow places like landscaping companies or residential construction companies to go back to work, even though she said, and she said specifically, Republican legislators had been calling for that. Well, as soon as she extended the stay-at-home order, we got reaction from the Senate Majority Leader and also from the Speaker of the House, and they both said that they disagreed with tightening the restrictions. They believe it's time to start reopening the economy, as they put it. Clearly, the governor does not believe that is the right message, does not believe that is the right tactic, and so at least till the end of the month, we're all still being asked to stay at home unless it's absolutely essential. Brian?
Yeah, and you know, a lot of folks, as you just mentioned there, Rick, getting antsy as this continues to be extended. Any indication that it could be extended yet again?
Oh, I think there is every chance that it can. The governor didn't say as much in so many words, but she did say, essentially, we're not going to flip a switch at the end of the month and it's all going to go back to normal. And what will the new normal even look like? I don't think we really grasp that just yet because, you know, we've been warned of that possibility of this subsiding here in a few weeks, hopefully, but then maybe another round that comes back in the fall and maybe even something in between. So I think it is wise to anticipate that going forward after the end of this month, there will be more executive orders. It'll also be interesting to watch to see how the legislature works with the governor on extending the emergency declaration, because that'll have something to do with the ability to extend a stay-home order if she decides to do so. So there's quite a bit going on here, but I think it would be wise to just think of this in terms of the next 3 weeks are going to be a pretty solid lockdown. If we're really good, if the numbers look better, hopefully after that, we'll have a little bit more latitude. But I don't think it's going to be anything like business as usual, maybe for a very long time, Brian.
Certainly not. All right, Rick Alvin, thank you for that. Big day there in Lansing.
You bet.
Meanwhile, in Detroit, the epicenter of the outbreak in the state remains the metropolitan Detroit area. Hospitals are at capacity, and we learned today that the field hospital in the TCF Center in downtown Detroit will start accepting coronavirus patients tomorrow.
We will see our first 25 patients starting on Friday, and we'll be ramping up in the upcoming days. This is a very important piece of our public health response. However, we still need medical professionals to staff our alternate care sites, as well as our hospitals who are currently handling this surge in COVID-19 patients. We especially have a need for respiratory therapists and registered nurses. We encourage those individuals, whether they're here in the state of Michigan or across the entire country, to reach out and help us. They can go to our website, michigan.gov/fightcovid19, to sign up.